Okay. I feel pressured because I'm the last, and I can feel that people are waiting. One more. Yeah. So just bear with me. But my name is Hesborn Wao. Did you know that just by somebody reading my name, they would be able to know one, where I come from, when I was born, which day of the week, what time? Yes, that is possible in Africa and in a country like Kenya, whereby if you are called Jane Anyango, A stands for female. And if you change A to O, then now you're a boy. So that is just something that maybe some of you didn't know about our naming system. Welcome. I would like to talk about a mixed methods evaluation of the impact of a short course training program in implementation research. So what I'm seeing here is not what is there. Can you help me? Sorry. So what is happening is that we know that there is evidence which is there, a solution, and yet the practice is still different. So there is need to bridge the evidence to practice gap. And so what is happening in most of the countries in sub-Saharan Africa or Kenya in particular is that we have problem with okay, no problem. So what is happening, what our problem is okay, is it better? So what is happening is that we have existing solutions, and yet we are still suffering. Talk of infectious diseases and all that. And we think that implementation research can really help. But now, how can it help if we are not capacitated? So the problem we are trying to address here is that there are not many people with knowledge and skills in conducting implementation research, especially in that part of the world. And so we know that the solutions are there. Many studies have been conducted, but not many people are able to, especially early career researchers. So the University of UC Berkeley and African Population and Health Research Center came together and applied for NIH grant D43, and they were funded to conduct implementation research training with emphasis in infectious diseases. So what I'm presenting here is just an attempt to evaluate the impact of that training. So we worked together, the two institutions worked together. We conducted this training over 5 years. The training was structured in the sense that it would last for 5 days, in person or virtual. And then we did this. You will pay for the remaining time. So we did this over 5 years. How we did it in terms of design, we had joint work together, as in terms of preparing the materials. We were not starting from scratch. We know that there's a lot of material existing. So we leveraged that. And then the participants were from East Africa. The training was conducted in different countries. We considered gender and other aspects. And then what we did in terms of evaluation, we employed the Kirkpatrick model, whereby we could ask, how did the participant react to the training? Did learning take place? Was there a change in knowledge due to that kind of interaction? And that kind of evaluation we could do immediately after the training. Then after time had elapsed for the participants to be able to apply what they learned, we could then do a follow-up evaluation, which we did after we had given them time to be able to apply what they learned. Then also, we asked ourselves, did the institutions where these participants come from, did they reap any benefit as a result of their participation in the training? So those were the guiding evaluation questions that we answered. We collected quantitative data, the evaluation surveys. We also collected qualitative data via focus group discussion. We got the focus group participants by categorizing the participants into two groups, those who were at least able to apply what they learned. And this evidence for this was maybe they were able to write an implementation research grant or publish something that to us interpreted, we interpreted that as being able to apply. And then there was another group who was not able to do anything with what they learned. Then we triangulated the data we got from FGDs and the survey data. And overall, what we learned is that there were some people who were able to transfer knowledge to practice. They were able to really bring changes to their institutions. And a major lesson that we learned is that most of the researchers, they can come and participate in an implementation research course like the ones we did, but if their institutions or the environment in which they work was not conducive, then that learning is not really going to go far. So if you find that there are some institutions that can give protected time to be able to engage in grant proposal writing, they have opportunities to interact with other researchers, present like I'm doing here. That's a thriving research environment which could help in learning and implementing implementation research, as opposed to an institution that don't do such kind of things. So it is important that when we think of engaging in implementation research, context is key, and the environment in which one operates is very, very important, that we create an environment that is conducive for realizing implementation research outcome. So that is, in a nutshell, what I wanted to present. And I have a record of being on time, despite the challenges.